Hello everyone, welcome to Chess Lessons. Today I am going to present few facts about lung contusion. Lung contusion or pulmonary contusion develop due to blunt injury to the chest in accidents. Pulmonary contusion is seen in 30 to 75% of patients with significant blunt trauma. Blunt trauma of the chest occurs when chest is compressed between two hard objects or due to deceleration of force when moving body hit against a hard surface. Main mechanism of contusion appears to correlate with severity of the crash and the proximity of the site where the patient hits. The possible mechanisms for contusion are the alveolar tearing or sharing at the gas leakage interface. Interior of the lung may be affected even in the presence of an intact pleura due to variation in intrathoracic pressure during the impact. The main types of contusion are type 1 due to direct chest wall compression against lung parenchyma. This accounts for the majority of the cases. Type 2 is due to sharing of lung tissue against vertebral bodies. Type 3 is localized lesion due to fractured ribs which directly injures the lung. Type 4 is due to underlying pleuropulmonary adhesions due to prior injury and then tearing the lung parenchyma due to trauma. Contusion presents usually late after the first 24 hours of the trauma. It can present for more than 1 week. Pulmonary contusion is often overlooked or missed during the initial evaluation because of its late presentation and also due to the other associated injuries. Clinical presentation is also misleading as it may vary from simple tachycardia and hypoxemia to severe acute respiratory distress syndrome. So, in X-ray, contusion is not diagnosed by the X-ray. Usually shows only non-specific infiltrates. Proper radiological evaluation with HRCT after 6 to 24 hours of injury will give important information regarding pulmonary contusion. This X-ray of a 28-year-old female who met with an accident and sustained fracture of both bones of lower lung on either side. The X-ray appears to be normal on the day of accident. Main mechanism of contusion appears to correlate with severity of the crash and the proximity of the site where the patient hits. The possible mechanisms for contusion are the alveolar tearing or sharing at the gas leakage interface. Interior of the lung may be affected even in the presence of an intact pleura due to variation in intrathoracic. HRCT is the ideal investigation to diagnose the changes in contusion. It shows dense non-segmental subpleural crescentic opacity on the side of impact, and the lesion becoming less dense and non-homogeneous in the form of ground glass appearance towards the deeper parenchyma. This finding is characteristic of pulmonary contusion. Density and depth of the subpleural lesion is decided by the force of impact. Here the CT thorax shows bilateral subpleural dense opacity on the posterior aspect. The HRCT card shows dense homogeneous density subpleurally on either side with extension towards the deeper parenchyma, which is non-homogeneous and in the form of ground glass opacity. Later, CT thorax was repeated to see the changes. So on the 14th day, you can see the clearance of shadows. Only minimal fibrotic changes are remaining on the left side. This HRCT feature is compared to the cut surface of a cheese pumpkin, and hence we can call this as cut pumpkin sign. You can see the shell of the pumpkin, which is equivalent to the chest wall, and the dense inner portion of the pumpkin, which is comparable to the dense subpleural shadow on the posterior aspect on either side. And as it becomes deeper, it is less dense, and this is comparable to the ground glass appearance. So this appearance is called cut pumpkin sign. Main mechanism of contusion appears to correlate with severity of the crash and the proximity of the site where the patient hits. The possible mechanisms for contusion are the alveolar tearing or sharing at the gas leakage interface. Interior of the lung may be affected even in the presence of an intact pleura due to variation in intrathoracic pressure during the impact. Thank you.